Hi and welcome. I'm trying to learn medicine. Today, Achalasia of Cardia and acid regurgitation. And after we've done that, we're gonna do standing yoga. And if you participate in the standing yoga, then it's at your own risk. I'm talking about internal anatomy and illness and diseases, and this is no medical advice, we're just learning about it. Now, the objective of this video is basically to find for us the difference between Achalasia of Cardia and acid regurgitation, basically out of curiosity, because it's pretty similar, but just the other way around, as far as we have it. We have them done individually, both, but now let's look at the similarities and differences. Achalasia of the Cardia. That is a rare disease in which the muscles of the esophagus fail to work properly. Normally, when food is swallowed, these muscles automatically set up a wave-like movement to the esophagus that pushes the food down towards the stomach. The sphincter at the lower end of the esophagus relaxes and lets the food through. In Achalasia of the Cardia, the esophageal muscles and sphincter do not respond to a swallow, and so food and saliva are retained in the esophagus, which becomes swollen. Okay, the swallowing doesn't properly ignite, or it doesn't happen properly with peristalsis, or the sphincter at the end is too tight, or whatever, and the food does not pass through, the food gets stuck in the esophagus. Acid regurgitation, a condition in which the contents of the stomach flow back into the esophagus and cause inflammation. And the cause is the legs muscles at the lower end of the esophagus. Achalasia of the Cardia, the food gets stuck because the end is doesn't relax. The sphincter and the food goes not to the stomach but gets stuck. Acid regurgitation of the end of the esophagus is to relax and food flows back. Symptoms: we have the symptoms: difficulty in swallowing, food felt stick, chest pain, and food and saliva can be breathed into the lungs. Acid regurgitation, a burning sensation behind the breastbone, which may spread to the back of the mouth. I don't think we are precise enough with the symptoms that you can make a difference or distinction, a difference or similarity. The one is burning sensation behind the breastbone, acid regurgitation. The other one is food felt stuck behind the breastbone, chest pain, difficulty swallowing, food and saliva, maybe breath into the lungs. Causes not known, Achalasia of the Cardia, so why know what the reason is that that happens. Causes of the other one, do we say lower legs muscles at the lower end of the esophagus? They use different things to say about what caused it. So the causes have it: the sphincter muscle ring at the lower end of the esophagus relaxes and lets the food through. Normally, like Achalasia, the esophageal muscles of the sphincter do not respond to a swallow, and so food and saliva are retained in the esophagus, which becomes swollen. Complications: we have achalasia, pneumonia, bronchiectasis, high risk of esophageal cancer. You have one, peptic and reflux esophagitis, and stricture of the esophagus. Esophagitis by acid regurgitation. The lining of the esophagus becomes inflamed and then ulcerated through the actions of stomach juice. Yes, because it was in the stomach and it got the acids of the stomach. The Achalasia of the Cardia was not in the stomach. It does not have the acids. Achalasia of the Cardia is not coming into it. It does not have the acids. Complication: pneumonia, bronchiectasis, high risk of esophageal cancer. So there's also something affecting the esophagus itself, and we still haven't found the difference between esophagus and esophagus. Maybe it's just a different writing. We haven't found it out. We wanted to do it in anatomy one time. But it's pneumonia and bronchiectasis, and that is because food can be breathed into the lungs. Why? Because it gets higher stuck. Food felt stuck behind the breastbone. They still don't know where the breastbone is. By the other one, peptic and reflux esophagitis. Inflammation because of the stomach juices, the acid. Treatment in the home, smaller meals and so on by acid regurgitation. The Achalasia of the Cardia. Small meals also. Both advised to be seated. Frequent drinks in quantity. They say take milky drinks and antacids which coat the lower end of the esophagus. Antacids can be bought at the chemist, do we say. treatment of achalasia, maybe also with surgery, with cutting or stretching the esophagus sphincter. By the other one, antacids. Let's try to gather together the information we have. Achalasia of the cardia is that after swallowing, the peristalsis movement doesn't properly work and pushes the food down into the stomach. The muscle ring, the sphincter at the end of the esophagus is too tight and the food doesn't get passed and the food gets stuck more or less in the esophagus. Acid regurgitation is that the muscles at the lower end of the esophagus are too lax and the stomach contents flow back into the esophagus. So that's the broad prescriptions, and what I know gets a bit more complicated. What do we want to say in our little presentation, our personal, private, publicly published presentation? So the symptoms. Both give a feeling of burning sensation? No. The one gives a feeling of burning sensation because it had the acid in it. Now we're going to say it like that. Now, the one was in the stomach, so it has the acid and the acid juices and the stomach juices of the stomach in it, so it gives more a burning sensation behind the breastbone spreading up to the mouth. The other one, more like food is stuck with chest pain and then also the possibility because it gets higher stuck. What is the explanation of that? Why it can be when breathed into the lungs and caused by bronchiectasis or pneumonia? And the other one, and that is why acid regurgitation can cause esophagitis, where the lignin of the esophagus through the stomach juices and the acid become inflamed and ulcerated. By achalasia of the cardia, independent of it. The risks are more that why is nowhere that it is when breathed into the lungs? Because it gets higher stuck? It would make sense, but if it comes by acid regurgitation out of the stomach, it is more at the lower end and there's no risk to breathe it in, but I don't know the exact anatomy to breathe it in into the lungs. If the other one is actually more stuck, more at the top, it makes more sense that it get then more breath into the lungs. Esophagitis, inflammation and ulceration of the lignin of the esophagus. By achalasia of the cardia, it is when because the food is when can be breathed into the lungs, pneumonia and bronchiectasis, and also an increased risk of esophageal cancer. But we want more into the differences. So maybe we're going to say not that much of a part of pneumonia and bronchiectasis, but maybe it makes sense. Both have been advised more or less to eat smaller and frequent meals seated up. There can be treatment to. If there's treatment, I think I said it when we did the acid regurgitation, to cut the sphincter to make it more lax, to get the food pass into the stomach. There must be possibilities to make the sphincter tighter with doing it, making it more tighter. Maybe we're going to say whatever we're going to do. We've at least 2 minutes in our yoga time. So that was the medical part. If you were here for medicine, and you can come back to the next part of medicine, we're going to do standing yoga. If you participate in the standing yoga, let's put the Augen ist. If you're standing together, you're breathing in through the out. We eat in space. And breathe out the arms down. Again in the arms up. And out the arms down. In the arms up. Out the arms down. Now in the arms up. And out open to the side of the police officer. Again in the arms up. Out open to the other side. Again in up. And make an inch space between the toes, open again to one side. Into the middle. Down, we're sinking down into half chair. We're going to come up again. Out open to one side. We're going to come up. Then we're going down. And up. Out and down, we're leaning onto our knees. Everything standing and go. Breathe in. And out, make a hell of a backward cat. Breathe into the middle. Out, make a hell of a backward go. Okay. And out, cat. Again in. Out the cow. Again into the middle. And out we come slowly around, back up and making it to the top. Backwards, shoulder. Now, breathe in, lift the arms up. Out, open to the side. Breathe in again up. Out, bring the arms on the side down, we're going down into the chair. Breathe in, come halfway up. Come higher up, and breathe out, and come up again. Breathe in and reach high. Breathe out onto the side. Breathe again in, reach high. Out, arms over the sides, we're going down into the chair. Breathe in, come halfway up. Higher up, and breathe out into the coming up. Now feet again together, breathe in. And out, lean back, door, shoulder blades together, up the chest to the sky. Verkrab in the morning. Breathe in, arms again up. Out, again the arms together, shoulders together. In. Now across the arms to the 20 fingers, reach high with claw. Breathe in, reach in front, all of the back, the dread. Again in. Out and back, verkrab in the morning, strap shoulder blades together. Breathe in, now across the arms to the 20 fingers, reach high. Forward reach, and hollow the back. Again in. And out to bring the arms over the sides down. Down diving dolphin. Now done with Marmot. Breathe in and bend the right leg. And breathe out and stretch the left leg. Breathe in and change. And out and stretch the right leg. Again in and change. And out and stretch the left leg. In and change. Out and stretch. In and change. Out. In. And out. Now in, both legs straight. And out and down. Now the penguin. Breathe in, lift the right hand up to the sky. Breathe out, bend the left knee, look over the right shoulder to the right hand. Breathe in, hand again down. And out and down. Breathe in, lift the left hand up to the sky. Breathe out, bend the right knee, look over the left shoulder to the left hand. Breathe in and down. Out and down. Now we're doing the pelican. Make a hand of space between the feet. Shift the weight of the heels. Breathe in and go down. And out and up again. And then in and down. And out and up. And the last time in and down. And out and up. Take the elbows with the hands and gently swing from side to side. Regurgitation counterweight. Both hands again down, bring the feet together, and breathe in. Come halfway up with straight back, monkey half lift. Out and down. Breathe in, monkey half lift. Out and down. Now breathe in the up diving swan, arms up. And again down. Now stretch of Venus, leg shoulders wide apart, and find the fingers behind the leg, bring them over to one side, tall up, shoulders back, breathe in. And out, head over to one side, and the chin down to the clavicle, breathe again in. And out, pull the arm in and the shoulder down. Again in and up. Out, turn the head over to the other side, hands over to the other side. Breathe in. And out, head down to the clavicle, pull the arm in, shoulder down. Again in, lift the gaze, turn the head back into the sky hugger, the feet are standing together, breathe in, lift the arms up. Breathe out, lean back with long arms. Out, lean back. Again in. Out, the arms down, doing the eagle swings, breathe in, lift the arms up. comes down. Again in the arms. Out the arms down. Another cactus collecting its stings in the evening. Breathe in. Bring the hands to touch and now the hands slowly down to heart center. Right, for standing yoga. I thank you very much and until next time.